In part one, you heard from Dr. Rafael Perez Figueroa about what decades of research tells us. Healthy father involvement promotes positive outcomes for all kids across the developmental spectrum. Now I ask, are child and family serving systems like child welfare, criminal justice, probation, courts, and child support enforcement equipped with the capacity to engage fathers effectively and authentically? This is an important question to grapple with. Service providers within each of these systems shoulder a profound responsibility. But do they have the knowledge, tools, and support to engage fathers in services to reduce those risks and, in turn, position fathers from diverse racial and cultural backgrounds to parent effectively, and in ways that align with their core values and beliefs? By the end of this brief lecture, I hope, 1, fathers and service providers can describe some of the circumstances and conditions that prevent providers from engaging fathers in services, and 2, service providers can evaluate how these barriers may prevent them from engaging fathers in services that may influence co-equal parenting and caretaking, and 3, that all viewers can use this information to apply a racial equity lens to fatherhood engagement and advocacy. What can we do to ensure providers are able to implement culturally applicable, father-focused practices, policies, and procedures? Here's a snapshot of recent rates related to father absence and household composition. Notably, over 20% of fathers are absent from all of their minor children. Overall, these numbers could explain why it is more common for providers to engage with mothers and why they may not be as accustomed to engaging in father-focused practices and policies. As we unpack fathers' interactions with systems, we must consider the pervasive racial and social inequities that inundate child and family serving systems. To that end, it is imperative to apply a racial equity lens. Between 2019 to 2020, 12% of all Black kids have had a father who was incarcerated, compared to 5% of Latinx kids and 6% of Caucasian kids. The snowball effects of disproportionate incarceration, removing fathers from families, imposing fines and fees, and employment barriers once released create additional barriers. Consequently, kids of color are more likely to grow up in father-absent settings or within a fractured family structure. While our knowledge of the effects of father engagement has increased over the past 40 years, there is still limited research exploring the concept of fatherhood and father engagement from the perspectives and experiences of human service providers. To our knowledge, there are only a few studies that home in on their perspectives. They focus on their experiences of engaging fathers in 1, early intervention, 2, services targeted for families with infants, 3, child welfare case planning, and 4, an evidence-supported parenting intervention. One recent study by Keynes and his colleagues interviewed service providers to gain their input on how best to support engagement of unmarried fathers. Across all these studies, issues of racism, mother-centricism, devaluing of fathers' role and capacity to parent, and lack of father-centric practices and policies were raised. While noteworthy, these studies do not elicit the experiences of providers who represent all of the varied systems fathers typically interact with, and they do not inquire about their intentions to refer fathers to fatherhood programming when available. As explained in the introduction, we were fortunate to receive funding for the Robert Wood Johnson Foundation to address these gaps. We relied upon interviews with service providers and leaders from child and family serving systems to explore their experiences of engaging fathers in services intended to equip them with the capacity to co-parent effectively. To unpack our questions, Mr. Kozart sent an email to his existing pool of providers across systems, informing them of the study in 2021. All interviews lasted between 40 to 90 minutes long and were transcribed and coded to identify themes. Here's a snapshot of the 24 Caucasian and African American service providers we interviewed. The mean age of the sample was just under 50 years of age. On average, they had been working with kids and families for over 15 years and were serving as directors at the time of the interview. Most identified as female, and nearly 2/3 of the sample earned a master's or PhD in social work or sociology. The sample of these providers highlighted two overarching themes. first one being barriers to father engagement, and the second one being strategies to mitigate them. For barriers, 3 salient types were discussed: systemic, societal, and micro-level barriers. These barriers explain why providers do not make referrals to father-focused programming. During the coding process, data revealed that they discussed strategies to address each of the 3 major barriers. I will first discuss these barriers and highlight the recommendations to mitigate them in Part 3 of this training. At the micro level, providers discuss challenges in telling fathers how to parent and grappling with staff who do not engage in reflexivity. This opened opportunities for biases about fathers' roles and ability to parent to prevail. Not assuming a strength-based positive approach with fathers was also noted as a micro-level barrier, as was the lack of awareness of applicable father-focused services in the community. For a third of the sample, individual participant biases, attitudes, and behaviors prevailed. Among these participants, they engaged in conversation that aligns with this notion of colorblindness, noting that demographics are not seen, race doesn't matter, facts don't care about color, or that white fathers struggle similarly. The same participants blamed the father for not engaging in co-equal parenting, noting that they lack intrinsic motivation and personal responsibility. Most of the sample, however, did in fact recognize the enduring effects of societal barriers, including the overriding sentiment that fathers are devalued and limited to a socioeconomic value proposition. They noted that society assumes fathers are uncomfortable sharing feelings with their kids, have commitment challenges, or assume that because they were absent in the past, that they can't parent effectively now. Systemic barriers were discussed at length. The majority believe that mother-centricism and racism permeate within child and family serving systems, meaning that systems favor mothers and believe they are the better parent, and therefore only engage with mothers. They underscore the intersectionality of mother-centric practices with that of racist attitudes and actions towards fathers of color. Providers' racial and gender biases remain unchecked, and the racial injustices within the criminal justice system often prevent fathers of color from building or maintaining a healthy relationship with their kids. Concrete barriers, including having to grapple with multiple and competing demands, economic challenges, as well as co-occurring addiction and mental health problems. In addition, there was pervasive sentiment that there is inadequate support or funding for fathers from the government. Outdated laws and regulations punish fathers and families by restricting benefits if the father lives in the home, and harsh penalties for non-payment of child support prevail. These emerging findings tell us that providers are not referring fathers to father-focused programming due to 3 reasons. The first one being their attitudes or assumptions of fathers as not motivated or willing to engage in services may influence their intentions to refer. Secondly, subjective norms, or in this case, societal perceptions that still view the father as a financial provider rather than as a co-equal caretaker decreases social pressure to refer. And 3, systemic barriers, such as mother-centricism and racism, and lack of investment in father-centric programming impacts the extent to which they have control over increasing father engagement and making referrals. In the next section of our training, I will briefly summarize what providers told us needs to happen to address these barriers.